Good evening, everyone, and thank you for tuning in to listen to the Minister of Health, the Federal Minister of Health, the Honorable Hajdu, who is my guest this evening. And I have to tell you, this woman is in the eye of the storm. She is the person who is going to have to deal every day with the crisis that we are experiencing right now. And, you know, she became a member of Parliament in 2015. She is from Thunder Bay North. Superior North, and she actually has a very interesting career. When she came in 2015, she became Minister for Status of Women, so she became a fierce advocate for things like pay equity, actually delivering on it. She then became Minister for Employment and Labor, and in that she started to fight the good fight for young people to be able to get skills and training and employment. And she began again to start working towards things like housing and drugs. This is an interesting one. Before she became an MP, she was very involved in looking at the drug issue in Thunder Bay. She chaired the committee that looked at finding ways to resolve the drug problem or to help those who have substance use disorders within Thunder Bay. So she comes with a wealth of experience and background, not the least of which is that she has a BC link. Now, she got her master's degree at the University of Victoria. So we're going to call her an honorary British Columbian just for tonight. That means that she knows what's going on across Canada and understands rural areas, understands urban issues. And I just want to say thank you, Paddy, for taking the time, for actually knowing how busy you are. You just ran out of a cabinet meeting to come and join us here. And I just want to say thank you for taking the time, because this is, people are scared, people are concerned, people are anxious, people are angry, people don't know what is going on half the time. And, you know, I know that we have questions here that I'm going to read for you. But I just wanted you to say a few words, introduce yourself, just talk to us for a few minutes before we start. And so I just wanted to say what a pleasure it is to have the Honorable Hedy with us tonight.
Well, thank you. Thank you so much, Dr. Fry and Hedy, as we call you in our caucus. It's such an honor to be doing this with you virtually. I'd prefer to be doing it with you physically in BC, and I'm glad that you've made me an honorary British Columbian because I have to say it's one of my favorite places to visit. I think all Canadians would like to be an honorary British Columbian, actually. Yeah. So you've got a pretty great province there and a pretty great city, actually, and region. Listen, I want to start with acknowledging just how terrible of a time this is for Canadians, for, well, world citizens. I mean, you know, I know you have a background in health. I'm not a health professional, but I worked for 9 years in public health. So I guess I'm sort of a public health professional. And I'm sure you have heard this before and all the work that you've done on public health care, but, you know, the world knew a big pandemic was coming, and yet it's very hard to live through something like this. And I now have a greater appreciation, I think, as someone, you know, I'm 54. I was raised in a fairly relatively peaceful time in our country, you know, no wars, no real drama, really, when you think about it. And what a privilege that's been my whole life, to be living in a country where we've had challenges, economic challenges, you know, all sorts of relationship challenges, but we haven't had a challenge like this. And this one is understandably frightening for Canadians, understandably very, very discouraging for Canadians. I think, you know, the prospect of a winter where we're being asked to continually stay apart from each other when we need each other the most, these are really tough times. And I think, you know, first and foremost, I think when Canadians are struggling, when they're scared, when they're worried, when they're lonely, I want to tell Canadians, oh, that's normal. Like, it's so normal to feel the feelings that you're feeling, and to, you know, cut yourself a bit of a break, because we're all trying our absolute best to get through this. I almost get emotional when I say it. I know people are doing their best. I know they are. I know people are making incredibly hard decisions every single day. And I know that, even when people are gathering when they shouldn't be, they're usually being driven by decisions that they're making because they're worried about their loved one, or they're lonely, or they're needing some human contact. And I think the biggest message I want for Canadians and people in British Columbia to hear today, and people in your riding to hear today, is let's be kind to each other, because we've got several more months of this, and we've got to stand up for each other, and we've got to be kind to each other. It's the only way we're going to get through it.
Yes, I agree with you. And there are so many people who are facing an increased amount of people with mental illnesses, the loneliness, the isolation, depression. We're coming into Christmas, which in itself is a time of depression and suicidal ideation. And so it's all coming together now, which is becoming overwhelming for a lot of people. What we're going to do is we have some questions that people sent in before time. So I'm going to ask a question. We're hoping that each question will take maybe 3 minutes or 4 minutes. I will read it and then you can answer it. So before we do, I just wanted to acknowledge that we are on the unceded territory of the Squamish, the Tsleil-Waututh, and the Musqueam peoples. And I wanted to thank them for having all of us here on their territory and welcoming us the way that they have done. Now, I want to read my first question. It's from Anthony. Now, he's from the West End Seniors Network, and this is a question. While the impact of COVID-19 on older adults in residential care is an incredibly important issue, equally important is the impact that this pandemic has had on the mental health of older adults attempting to stay safe at home. What steps are you taking and will you take to address this parallel crisis of older adults' mental health? There's a second person, just one more person, Jerome, added to this question by saying, what supports can the federal government improve for implementing the support mental health for youth during the pandemic? So we have both ends of the spectrum, support for youth and support for seniors.
Yeah, it's such an important question. And I'm so glad that people are talking about mental health. And, we know, both of the Jerome and the other questioner both highlight what I think is becoming apparent to everyone, that the longer we're in this situation, the more people are suffering at all spectrums, whether we're talking about older people, oftentimes single or alone or living in long-term care, for example, or oftentimes separated from their normal activities of life. I think about the amount of young people too that are also struggling, right? This is disrupting school. This is disrupting their studies. This is disrupting what I always say is a critical part of their development, which is the need to socialize and the need to get to know themselves by socializing with others. So there's a few things. We knew early this was going to happen. We could sort of obviously go to the literature, but also just from what was happening around the world, and Canada, as you know, was watching what was happening in other countries. And so we rapidly stood up something called Wellness Together, which is an online portal. I wish more people knew about it. It's a free resource for every Canadian, every person that needs it. And you just have to go to wellnesstogether.ca. There's resources available in French and English. You can do a self-assessment. And I highly encourage everyone to do it. I have done it. Varies depending on the day, how well I'm doing. But not only that, you can get hooked up with actual paid professionals, psychiatrists, psychologists, social workers, a variety of different kinds of helping professionals at all different levels. And they're providing services virtually, by phone, by text. Obviously, oftentimes actually youth prefer to text. Lots of people prefer to text. And what I would just say is it's completely confidential and private too. So, it's a great tool for yourself. It's also a really great tool if you know other people that are struggling. We've all seen friends in our lives or family in our lives that are struggling with more substance use. More people are reporting they're drinking more, they're using more substances, they're eating more, they're falling sort of into habits of less healthy behavior, because obviously it's so much stress, and we as humans are programmed to try to make ourselves feel better. I use this because for me, I love to eat when I'm stressed out. And so there's obviously coping tools that can help. The other thing is we've been supporting provinces and territories in the area, for example, of substance use to get more programming in place, whether it's safer supply and all kinds of other things to try and save lives for people with very problematic substance use. And we've also been funding a lot of the support help numbers, the suicide prevention numbers, the kids' help phones, those kinds of places that do amazing work day in, day out, all the violence prevention work and the women's shelters and the women's violence prevention centers, because also that sadly is on the rise as people are stuck together. So those are the kinds of things we've been doing. But if I can leave your questioners with anything, it is wellnesstogether.ca. Check it out. 2 official languages, translation in over 200 languages. So very, very accessible. And if your language is not there, let us know and we will add it.
I'm glad we talked though about phone lines, because a lot of the seniors in my riding don't have cable. They have one landline. They don't have access to Wi-Fi, because it's not just about distance. It's also about income. A lot of them can't afford it. And a lot of people can't afford to go online. And so the phone lines are important things to give them the support they need, that they can at least pick up a phone. And what we have done is we've resorted to snail mail and other ways of getting at our seniors so that they can know where they can go to get the kind of help. But thank you very much for that. And I just want to go on to the next question, which is about vaccine distribution. As you well know, you've been getting this going on in the House of Commons now for quite a bit. And it is a very difficult and complex issue, and a lot of people don't understand that. And so I have a question, and there are 1, 2, 3, 4 people that I kind of pulled together because the questions are basically about vaccines. And Sheena from Richmond's Chamber of Commerce says, when vaccines are available, how should we expect distribution to be allocated? Furthermore, will there be a passport or other system to denote who has already been vaccinated? Anthony from Vancouver said, since health is largely handled by the provinces, what have been some of your biggest challenges when coordinating with all of your provincial counterparts during the pandemic to get vaccines? Hedy from Vancouver said, what are your plans for introducing the COVID-19 to Canadians? How can the federal government play a more active role in funding scientific research based on physical and mental health comorbidities? And Debbie from St. Paul's Advocacy said, how will the vaccine be distributed after essential services, seniors in care facilities? What about those persons with disabilities and seniors living in subsidized housing? How are we going to get at those people? So as you can see, a lot of it is about vaccine distribution, a lot of it about how we plan to do it. And some people have already recognized that this is province are going to have to distribute this. So what are you doing and what are the challenges? And I just wanted to add one more thing about vaccines, if you could comment, because a lot of people think that when a vaccine happens, everybody will be cured. COVID will be gone forever. And this is not true. And why aren't we picking up the vaccines when the United Kingdom is picking it up? This is a big question everybody's asking. And you know full well that the government of Canada and public health cannot put a vaccine out there for Canadians to use, even though it's free, if it's not safe and if it's not effective. And those are the 2 big hurdles we are jumping through, because we want to protect Canadians and we want to make sure that when they get a vaccine, that it's going to be able to assist them in having some kind of very mild case of COVID-19. So I will let you pick up those questions.
Okay, this might be a bit of a longer answer. I'll try to condense it as much as possible, but it's a complicated topic, as you would know, because it's not on or off. And you're right. I think I'll start with where you left off, which is, actually part of your question, which is, or observation, which is, are vaccines going to mean that COVID-19 disappears? And I think, there's a simple answer to that. And the answer is no, but you can look at other diseases like polio, for example, is a good example. Measles is a good example. Mumps are a good example. There have been diseases in the past that have been just as threatening to societies. And some of them have brought, for example, influenza, tremendous amount of suffering and death every single year, actually, with influenza, not to the degree of COVID, but certainly a high degree of death, especially in older people related to influenza. And we know that some diseases like coronaviruses, like COVID-19, are actually really hard to sort of quote unquote kill. Like once it gets to this point where it is so endemic, that means it's everywhere in every country, it's high degree of circulation. It gets really hard to put it out, if you will. And so vaccines, though, are going to be such an important part in actually reducing the amount of spread and saving lives. That's what they're about. They're about saving lives of people who are going to die if they get COVID-19, and then reducing the spread to a manageable level so that if you can think about the flu every year, it's kind of like that, where, it's deadly for some people. It circulates through the population, but if enough people get vaccinated, it actually reduces the number of cases that healthcare systems have to work with. That's, I think, what scientists are more or less thinking is going to happen with COVID-19. So we have a couple challenges getting there. One, the vaccines are brand new, as you pointed out. The UK just approved the first vaccine that from a major manufacturer that is a credible manufacturer today. We don't think our decision will be very far behind. We have almost all of the data that we need from Pfizer. Each vaccine company provides, typically this takes over a year, by the way, to approve a vaccine. Typically what happens is vaccine companies or manufacturers of other pharmaceuticals, they have to do all the clinical trials. That means testing it in people and making sure there's no side effects, and then submit everything at the end. And then Health Canada takes another year to review that. In this case, we've actually changed the way things are done, and we've sped it up by providing an opportunity for the companies to provide the information as they get it. And then we're reviewing the information as they get it to speed up access. But I want to really stress what you said, Hedy, which is that we will never compromise on the safety. And so when you hear politicians, particularly those across the aisle from us, saying, well, why doesn't the Prime Minister approve a vaccine? Why doesn't the Prime Minister approve a rapid test? What they're actually saying is, we should have politicians make these decisions. And I reject that. I think we should have the scientists, the researchers, the experts make the decisions after they've reviewed the data. So to your point, we can make sure they're safe for use in Canada. Now, a couple other questions I just want to hit on, because that was a big question. One of the questions was, when vaccines are available, how should we expect distribution to be allocated? In the first part of receiving vaccines, the two most promising vaccines that are closest to approval are kind of complicated vaccines. They require really cold storage. Also, by the way, the world is chomping at the bit to get them. So these manufacturers are making decisions based on number of people in your country, the disease activity, all kinds of things. And they're allotting certain doses to different countries. So Canada's going to get a small amount, 6 million doses of the two vaccines in the first few months of first few months of 2021. And then after some of the more usual suspects, if you will, vaccines that use more easily distributed sort of style of vaccine, once those become approved and become, start rolling off the sort of delivery line, if you will, or the manufacturing line, that's when we're going to start to see way more volume arrive. So I think for the first couple months, we're not going to have a lot, and that's why we have to prioritize. But after that, we're going to start to have a lot of vaccination available of different kinds. And the other thing that we don't know quite yet is which kinds work for which people, because sometimes not all vaccines work on all people. So some might be for older people, some might be for, younger people. We don't really know yet about pregnant women, children. There's not been a lot of research on children. So that work will continue. And actually the vaccination is going to provide some of the details around immunity, because that was another part of that question, or one of the questions was, what about these immunity passports? It's a little bit fragile, that idea, because we don't really know yet. Is this immunity something that lasts forever, like measles and mumps? People say probably not, because it's a different kind of virus. Or is it something that lasts for a few months? Does it mean that you're still infectious or not? Probably not still infectious. Probably you are for sure protected from COVID-19, or at least the severe, but most people, don't forget, there's still some people that will be affected. So there's a lot of unknowns in terms of the immunity piece. And that's why I think immunity passports and that idea is a little fragile still at this point in time. We're going to have to be really thoughtful, I think, as a society, how we include or exclude people, but also how we stay focused on protecting the most vulnerable.
And we have about 7 producers of vaccine that we have actually done contracts with, so that once they roll out their stuff, we will get it. And so I understand you answering in the House every day, you're saying, oh, but we're looking at over 400 million possible doses of vaccine, because we don't know if it's just going to be one vaccine needed, or maybe a phased of one and then 2 another thing, because all of this is still up in the air, as you said. Everything is being done quickly instead of having the time to do the research while it's going on. So I think those are important things people need to know. And finally, I think the question is, once those vaccine comes out, you have a plan for distribution, because the vaccine has to be kept at a certain temperature. It is very low temperature. And I know that you have the armed forces, a general who's going to be in charge of all of that protocol, rollout, process, to make sure that it's done properly. Can you talk about that?
That was a meeting I was just in. I was talking and getting an update from my officials about what was happening on the distribution plan, working with provinces and territories. I think it was Hedy or perhaps Anthony that was talking about. I think it was Anthony that was talking.
It was Anthony who asked.
Yeah, provinces and territories. We are working. I know that it doesn't always seem this way, because of course politics is politics, but at the officials level, at the healthcare level, things are going very smoothly in terms of vaccine distribution. In fact, they're planning and practicing how to distribute, in particular, these really complicated vaccines. And they're planning for all kinds of things to go wrong, because undoubtedly things could go wrong. Think about, we live in a northern climate. There could be an accident with one of the trucks that's delivering vaccines. There could be a problem with one of the batches of doses. And so we're planning for all of those problems.
Eventualities, yeah.
That's exactly it. And, that's a really important piece of actually success. And so that work continues with provinces and territories. Tomorrow, and I'll give your viewers a sneak peek, there's going to be an actual technical briefing for media on the plan of distribution. So there'll be a lot more information in the news tomorrow about what's happening and how the provinces and territories are interacting and how those priority populations will be chosen, hopefully, by the provinces and territories. Just to be clear, I know Sheena was talking about who it will be allocated to. The federal government gives some very broad recommendations, but then the provinces and territories who actually deliver healthcare, they refine those decisions, and they're the ones that will decide at the end of the day who will be first in line and who needs to be prioritized. But I can tell you this, I'm pretty sure they have their focus on the same exact goal, which is to save lives and stop spread.
Yeah. Well, that's great. Thank you, because I know that people are confused about vaccines, and you gave us a really good sense of understanding how it works, what it's going to do, what it could do, and how much we still don't know about what the results are going to be. So I think it's interesting. People can get that information. They can think about it. And of course, everybody knows that if you want to get any further information, you can contact our office, and we will let you know whatever is going on. But because the media is getting a briefing, you should all tune in to watch what the media has to say, because the media so far has been making statements without actually understanding. Now they're going to get the technical understanding, and then you can get the facts from them once they get that briefing. Now, we've got another question, and it's from totally different. It's from Spencer, and it's about the drug Therapsil. And Spencer says, psilocybin mushrooms have been shown to help patients who suffer from addictions and mental health problems, as well as on palliative care issues. Why are we only allowing palliative care access to mushrooms? Why don't those who have substance use disorders or people with suicidal ideations get access or deserve access?
Well, thank you very much. And this is a newer area of study. And I know that Therapsil has been very active in advocating for access to psilocybin as a way to alleviate the suffering at the end of life, and increasingly as a way to treat people with other conditions. In fact, we just allowed, through my Section 56 exemption that I hold as a health minister, access to someone who was not at the end of their life and was struggling with a whole bunch of mental health issues. And that was a very, I think, exciting moment for Therapsil and for many people who are, looking at this as a potential therapy. I also am happy to say that yesterday, Health Canada granted exemptions to a number of healthcare professionals who wanted to possess and consume mushrooms containing psilocybin. This is also something that is, I would say, controversial for some and not for others. But the doctors that prescribe this therapy wanted to understand what it would feel like and how to best use it to help their patients that are struggling. That's exactly it. And I think, this is part of our government's approach on drug policy. We have always said that we believe in science and evidence. I think we need more evidence in this area, and I would encourage Spencer and Therapsil to partner with our office, because what we're trying to do is collect that research. It's so important not just to understand the potential value of the treatment with psilocybin, but also to help pave the pathway for others that maybe don't understand this. And the more research that we can get and the more understanding that we get through clinical trials and research, the better it is. So we're on standby to support any organization or academic or healthcare professional that's interested in applying for clinical trial authorization. I think that would really help move forward this conversation and take it kind of out of the shadows and into more of a mainstream conversation.
Yes, because I think there are all kinds of moral judgments and other things. I mean, in the 60s, whenever we was doing LSD, people keep recalling those things. But in fact, most of these products have some medical benefit. Now, I think it's interesting that some professionals are going to be able to try it, because especially when you're looking at psychotherapy, psychologists, psychiatrists, being able to understand how the patient is impacted by the drugs, what is going on in their sort of psyche, what they're feeling, what it does to their perception, is going to be very important if you're going to treat patients with psilocybin and with psychotherapy at the same time. So that is a good way of looking at how we can move forward. Now we've got Jordan from Vancouver, who asks a very loaded question. Why hasn't BC signed on to the federal COVID-19 app? It's a question I've been asking as well. So I'm waiting for the answer, which you may not be able to give because
I may not have it. I can tell you that we would love for BC to sign on. And I know that, listen, Dr. Henry is a very trusted public health official, as she should be. And I think she's doing amazing things for British Columbia. But I think the more of us that sign on to this app, obviously the stronger the tool becomes. It's really important for a couple of reasons. I mean, I'm speaking about individuals right now. I mean, some people are really stigmatized by getting COVID-19. And it's a hard conversation with a public health officer to say, oh, I have a special friend and my wife doesn't know about that special friend, for example. Or, oh, I went to a party and I saw 3 people, but I told them that I'd had a negative test, but I didn't really. Like, these are the kinds of things that people are struggling with.
Reality,
yeah. The reality, right? We and sometimes it's just people can't remember. They've been so active, they don't remember the long list of people that they may have spent time with. So COVID Alert actually helps out in those circumstances, and it provides complete anonymity to both the user and the person who's been diagnosed. So
I think that's important. The anonymity, the privacy, that you just know that you have been in contact. You don't know with whom. Nobody says anything. So you just say, okay, you've been in contact, go on. And I think one of the problems is that we well know that if you're going to phone people to do contact tracing, most people won't answer the phones. Most people don't know who's calling them. Most people won't pay attention to a letter in the mail. But if you carry your cell phone with you all the time and it goes ding and it says you may have been in contact with somebody with COVID-19, get a test.
That's it.
That's there. It's easy to do.
It's empowering actually for people. And so we updated the app last week so that it actually alerts users, even if they were in contact with someone who was developing symptoms, because we know that you can be contagious even before you have symptoms.
Yeah.
But I'll tell your listeners this, even though the province hasn't signed on, there's nothing stopping them from downloading the app because they can. And if they have contacts from other provinces, I know lots of people, for example, have family or relatives in BC or other parts of the province, or sorry, Alberta, other parts of the country, that it will actually still work. So if, for example, you have COVID alert on your app, Hedy, and you come to Ontario and an Ontario member of parliament tests positive, you still would get an alert, even though you're in BC, that you've come into close contact. So I would say, even if the province has not signed on yet, and we sure hope they will, that you download the app anyway, because especially if you have any contact with people that are leaving the province, because it gives you another sense of security and another layer of protection.
But every province is signed on with the exception of BC and Alberta. Is that it?
Yeah, I think there might be some of the northern provinces too. I can't recall, but yeah, pretty much it's BC and Alberta that's left. And listen, I mean, Alberta could really use it right now. And the other challenge is, don't forget that as systems get increasingly strained with growing numbers of people sick with COVID-19, the contact tracing falls apart. You just can't continue as a public health agency when you're getting more and more and more cases. It gets harder and harder. And eventually public health agencies give up. And you've heard that, high profile places saying we no longer, Toronto, for example, no longer contact tracing at one particular point. That's because they just can't. But the COVID alert app continues to do its work, and it does its work efficiently. So it's an actual opportunity for BC to, especially as cases are climbing all across the country, to really have that additional digital tool to give a break to the public health nurses that are just trying to keep up.
Yeah, well, that's good. Thanks very much. And now question 5, David from the Greater Vancouver Board of Trade is asking, how is the Government of Canada working with the travel industry and airports to deploy testing and open up travel? How has the pilot program in Alberta gone? And I think British Columbia is especially hard hit with its tourism sector with regard to closure of airports, with regard to airplanes, and with regard to testing itself, pre and post testing in airports and stuff. So, this is a very important question for a lot of us in BC.
Oh, it's, listen, I know the issue in BC around tourism is so huge. As a matter of fact, early on, and I think you and I were together, or you knew I was out there anyway, early on in COVID-19, it was apparent that the tourism sector was going to be the first hit and the hardest hit. And, in fact, that's exactly what's happened. And obviously restaurants, bars, hotels, anything that's associated with that tourism industry is equally suffering. And so people are saying, well, what can we do to help the tourist sector? So I think, listen, we've tried to put together, as you know, and I think we've done a good job in terms of economic supports, but the challenge is that for tourism providers, sometimes those economic supports just aren't enough, because how can you keep people employed if there's no tourists? And it's very, very challenging, and our government fully understands that. We're trying now to understand better in terms of the border and people coming in from other countries, how we manage, or right now it's actually Canadians, because we haven't changed our stance around foreign nationals, but right now we're trying to understand how we reduce that 14-day quarantine, and we continue to make good on our commitment to provinces and territories that we limit the importation of COVID-19. Nobody wants more cases to deal with. So we've got a few testing pilots across the country, one in Alberta, one in Vancouver. Actually, it's not actually government run, the one in Vancouver, but it is a very good study. There's one in Toronto being run out of McMaster. These 3 research studies, in particular the one in Alberta that the Government of Canada is actually actively involved in, are going to give us better understanding of the blend of testing and quarantine that could be applied to really keep those numbers of importations low. Nothing I've heard about from Canadians trumps, no pun intended, the need to keep the American border closed. People are terrified of what's going down there. Yeah. BC had a particularly early taste of that, right? That's where the real growth started to take off from. It turns out it wasn't from China. It wasn't international travel. It was, the shared reality of having Seattle so close to you, and the sort of West Coast United States. And so we've got to get this right. And so that's what this research is about.
And the going through to Alaska is a big one for us in BC. Yeah.
Yeah.
I was going to say I have a young friend who goes to the University of Victoria. He's doing his master's there. And of course, his mom is from Alberta originally, but a long time ago. He's been living in British Columbia now for about 10 years. And his mom just decided to get a new car and gave him her old car, which of course still has Alberta license plates. And he drove it and he parked it. And when he came to get into his car, it had been vandalized so terribly because there was an Alberta license plate. So we're dealing with all of these. It's fair. Fear stokes anger. People are really concerned and don't stop to think that this young man had been living here for 10 years.
Well,
Yeah.
see, we've got to not do, like, I know it's really, I mean, I'm probably speaking to the converted. I can't imagine viewers on your town hall being that kind of person, but we've got to stand together. Listen, nobody gets sick on purpose. And nobody's willfully carrying the virus around. This is a really sneaky virus. It can feel like nothing for some people. You know, my partner has allergies, and in the early days, he could not tell, was this a sore throat because of allergies or not? Now he has a system. He takes an allergy pill, and if it goes away, he knows this is allergies. But
that's hilarious because I take an allergy pill every morning because I have allergies. And of course, I have asthma, and my asthma is controlled. But I take this pill because this is a time of year when I am sniffling and sneezing and getting, a sore throat in the mornings because of the mold, which is the rainy BC mold. And of course, and I get brown leaves when they get crushed, that whatever they puff into the air gets me trouble. But you're right. I take that because if I get up in the morning and it goes away, I know it's nothing. And it's just my allergies.
Right. So yes. Let's be kind to each other is my point. And, honestly, nobody's trying to infect anyone. Like this is not, and we have to remember that these are extremely, extremely sneaky viruses, and the way that it expresses in your body could be so mild that you may not even know you had it. And that is what we're finding is that, with the immunology, there are people that have had it that don't even remember feeling symptomatic, all the way up to people who are extremely ill. So let's be kind. People are not trying to import this virus anywhere.
No, be kind and also be careful because I think a lot of people who are asymptomatic can be contagious. So just being careful, listening to what the public health rules are, following it, please. And I know it's tough. Especially for people who live alone. Mm-hmm. It's really, really tough. Anyway, but that's one. And now I have Will from UBC asking, do you think if citizens, if citizens were told where in specific locations that COVID-19 is experiencing higher spikes, grocery stores, parks, etc., would that encourage people to adopt more social distancing and mask wearing?
Well, it might. It also might give people a false sense of security that if they didn't go to those places, they would be fine. And the reality is right now, we know that spread is happening, not just in public crowded spaces, but in private homes, through small gatherings. You might have a birthday party and you all feel just fine, to our previous question. And you're the one that imports it to your family. And so I think, the safest thing right now is to just assume you have the virus. I've heard this somewhere and I thought it was brilliant. Just assume you have the virus, and assume that you may infect people and act accordingly. Wear your mask, wash your hands, stay at home as much as possible. I know that that's not a positive message. It's not one that anyone wants to hear anymore, but I'm staying at home as much as possible. I go to work. I don't go to restaurants. I don't go to malls. I go out as little as possible. I get food. I come home. Like we really, all of us need to be embracing this idea that we're going to have to really keep our social circles small. Sure. You know what? If you absolutely have to see someone, you're living in the best province to do that because you can do it outside. Maybe you could meet at a dog park and walk walk the dogs together. Maybe you could, sit outside socially distanced in a backyard, 6 feet apart in the outside, low risk. But, once you start to come together in crowded, closed, contained spaces where aerosolized viral droplets are living in the air, the longer you spend in that space, the higher the risk that you could contract COVID or that you could spread it. So this is why I think, that information is not necessarily all that helpful. I think what really people need to remember is we're not out of this yet, and we have to do this to protect each other.
Yes, I think that is a basic and important message to give. Now, another question, 7, Anthony from Vancouver again. Anthony's, I did the same Anthony, a lot of different Anthony's in Vancouver. Anyway, since health is largely handled by the provinces, what have been some of your biggest challenges when coordinating with your provincial counterparts any of the COVID-19 precautions, testing and tracking during this pandemic?
Well, it's a great question, Anthony. And I think the challenge for the federal government is that we don't deliver healthcare. It is the responsibility of provinces and territories, and we're there to help them, achieve their responsibilities, but we don't deliver it. So it's been really frustrating in some ways when, as the federal government, we have very limited tools. I would say this is what I can provide as the federal health minister: money, advice in the terms of guidance, and equipment, and that's the challenge. Now, having said that, Dr. Tam works really closely with all the medical officers of health across the country, and they have something called the Special Advisory Committee, and that's how that guidance gets created. So, I think that has been an aspect of good coordination. The challenge is, of course, at the political level, right? If we have political leaders that don't take the virus seriously, don't act quickly, don't, impose restrictions that need to be there when cases are too high, then we see real significant challenges and death, actually. And,
Yes.
The reality is this is not the time to be playing politics. I always like to say, it doesn't matter if you don't believe in the virus believes in you. And I think this is really important. And, we have research, science, and evidence that suggests that the less we move about, the more we can protect ourselves from this virus. Nobody wants to do it forever, but we have to do it for a few more months.
And I think you're right about the politics and not politicizing this issue, because the thing about COVID-19 is that it behaves the same way in Paris, it behaves the same way in Sydney, Australia, it behaves the same way in British Columbia and in Prince Edward Island. And therefore, we know how it behaves. We know how it's spread. We know what it can do. And therefore, we know how to protect people, how to contain spread, and to do all of those things. So the science is the same everywhere. But when politics enters it and people are ideological and don't listen to the science, that's when Canadians are put into jeopardy. And that's when things start falling apart. And I think that that's really, really important for everyone to remember, that it is, as I said, the virus never read the Constitution, doesn't know anything about federal, provincial jurisdiction. It doesn't know anything about borders, and it doesn't care about borders. And so it acts the same way everywhere, and it causes the same tragedy everywhere. And we know how to prevent it, and we know how to protect ourselves from it, and we should just listen to the science. And this is where, because you said at the very beginning, you do not believe that you as a politician, and all politicians should be making these decisions. You are guided by what your public health officer tells you, by what the science tells you, by what you're advised about the science. And I think this is something to bear in mind and to remember at all times, to trust the science, because it is really important.
We have no other way out. I mean, science has saved us time and time again in medicine, right? I mean, medicine is based on science, and we all know that the science evolves. I mean, things change. We learn more. COVID-19 was brand new to the world in December, January, February, March, but we're gaining more knowledge. To your point, what does it behave like? What is it like? What doesn't it like? How do we, defeat it together? But honestly, it is science that's going to show us the way. And it's science that's developing the vaccines. I think there was a question about what investments we're making in science and research. Over $1 billion we spent on research and science for COVID-19 alone. And
yes.
That, just indicates our government's belief in science and research, but also our support of it. And, I'm so glad that we made those changes in the last mandate where we boosted capacity for researchers and scientists around the country. Can you imagine if we had been starting at less than zero?
Yeah. No, I think that is really, really very important. Now, will you support, and this is Jason from Vancouver, will you support giving all Canadians access to free contraception?
Mm-hmm. Well, listen, I think this is a party that believes in women's rights and women's choice, profoundly. We've stood up for it time and time again. I don't have to relitigate that. You know the story more than I do, Hedy, because you were there during those formative discussions amongst the Liberal Party. And it's partly why I'm a Liberal, because I truly believe that if you don't stand up for women's right to reproductive choice, then, not much else is possible. And in fact, it's the foundation of feminism. It's the foundation of equality and gender equality. So we actually believe that, we need to do more to stand up for reproductive health, not just here, but around the world. And I'll just say that I think where we can actually make some headway on this request or this question is with the work that we're doing on a universal pharmacare program. I think whether it's contraceptives, whether it's other kinds of pharmaceuticals, I don't think people should have to choose between eating and taking a medication that they need, whether it's for contraception, whether it's to treat their illness, whether it's to prevent an illness. And so I think the work we're doing on pharmacare is going to be pivotally important, and it is going to make contraception low charge or possibly even free for women all around the country. And I'm looking forward to the next steps.
That's good. Thank you. Now, a question from John. More people have died from opioids than from COVID-19 in British Columbia. What are you doing about it? That's an open-ended question.
It sure is. We've done more. Listen, we have done, this is one area that I can say, I came into politics to do more for people who use substances. I came into politics because the former Harper Conservatives were not just dumb on substance use, they were cruel on substance use. And cruel to substance users. And, to restore harm reduction to Canada's drug strategy has been, I think, pivotally important to people who use substances. And in fact, we were seeing opioid deaths go down in Vancouver in particular, but all across BC just before the pandemic. So it's particularly heartbreaking to see those numbers go up again. And we know why. People are isolated. They're using substances alone. They're having a harder time finding, street drugs because of disruptions at the border and all kinds of other reasons. But, we've done more than I would have thought was humanly possible. I mean, we legalized cannabis. I know it's not the same thing, but that is a brave thing to do and a strong statement about the use of substances and it being a personal choice. Safer supply programs in Vancouver, 2 of them that allow for people who use opioids to get prescription opioids instead of seeking toxic street drugs. Safer consumption sites, funding for programs at street level that are working with substance users that are trying to provide supports. Here's where I think, the province and I think the municipality of Vancouver is interested in going, and that's decriminalizing small amounts of substances. I've been working really closely with Mayor Stewart and just recently talked to the new Minister of Mental Health and Addictions, Minister Malcolmson, who was my critic as status of women. So I know her really well. She's lovely. Yes. And I think, I think that we've got these requests in, and I think that, we're working through these requests with the province, with the city. And I'll just say this, I've always said that we should be there to provide the tools and the resources that the community says they need. So that's why it's kind of an exciting time in drug policy, because I think there's some potential there to work with the city of Vancouver and with the province of BC to figure out what exactly that might look like and what, and how it might be implemented if that's the choice that the communities and the province want to pursue. And finally, I'll say this, it's not the silver bullet. And I think every leader in BC knows that. I think, we have to do way more for sort of the quote unquote middle class. I call them the hidden opioid overdoses. And these are, primarily men, 25 to 45-ish. They're often employed, and they're often employed in the trades. And I actually have started a process working with tradespeople to dig in deeper to how we actually reach these fully employed guys who would never go to a safe consumption site, who would never likely even tell anyone they were problematic substance users. And we need to do a better job with those folks because, in fact, the numbers show that they are largely the ones dying of opioid overdose, even in BC. So we're working on the street engaged folks, working with better supports, more compassionate care, more access to supports that meet their needs. But I think we also have to work on the folks that, aren't what we would typically see as people overdosing on opioids.
I think when we first came in and the Minister of Health actually allowed for safe injection sites across the country. If you remember, the Harper government had stopped it. had put a kibosh on
Supreme
it.
Court. Took it to
Yes.
the Supreme Court. Stopped the
And the
Naomi
Supreme
trial,
Court
which were
says,
the
yeah.
predecessor of Safer
Yeah.
Supply. You know, it was just ideological and it was cruel. And I have a lot to say about that time because I was intimately involved in all that work. But, you know, listen, fabulous leadership has come out of BC on drug policy. It always has. You know, I did my thesis at the University of Victoria on municipal drug policy and spoke to people like Don McPherson and Senator
Yes.
Campbell and, you know, folks that have been involved in that space for a very, very long time. I can't remember what's the name of the drug user group that's so famous.
Vandu.
You know, these are the people who have led the charge for more compassionate drug policy, and their legacy will never be forgotten. And, you know, good things have happened across the country because of BC.
Well, when I was asked to do this off the side of my desk in Chrétien's cabinet, the person who really kick-started this whole idea off was the then mayor of Vancouver, Philip Owen. So we have the mayors of the city. He's the one who said, you know, he went to Europe, he saw what they were doing, he came in, and together we started the first safe injection site. It was a pilot project with Rio Montana and UBC. And so it all started here. And I mean, BC is at the cutting edge. And I think it is important that we got the safe injection site across the country for cities that decide they need it or towns that decide they need it.
Even town, Thunder Bay.
Well, but I think it's also important that when people were dying of overdoses, that we were able to give everybody access to naloxone, which could save their lives immediately. Not saying you have to get a health provider to do it or somebody. You've got it, you carry it in your purse, you put it in your pocket. Anything that happens, you can save a life immediately. These are really important changes that most people don't know that we did. And I want to thank you for the $6 million that you gave to British Columbia so that the drug faculty at UBC can work with the doctors of BC and the nurse practitioners of BC to give prescriptions. Because most people, like that guy, that trades guy, he's going to go to his family doc or whatever and say, hey, doc, you know, I need a prescription. Get it. Nobody else knows. He comes into the doctor. What he went to the doctor for. And so that gives that privacy and that anonymity for those middle-class users. But I do think that we still have some problems with the street drug users, the ones who are using intravenous drugs, because of the fact that they need intravenous safe supply. And we know that getting intravenous safe supply is a very big problem. Crosstown Clinic is the only one that can do it, and they don't have enough doses.
It's hard to come by. The drug is hard to come by. There's some interesting work on that. We could talk about drug policy all night, I think.
But I think we need to look at what Perry Kendall and those guys are asking for a non-profit pharmaceutical that can make drugs available for intravenous drug users on the streets so that they can get it without having to look for us finding diacetylmorphine and hydromorphone from Switzerland, which can only, I gather, give us 200 doses at a time. So, you know, it's really time that we started to get a safe supply moving for everybody. That combined with the stigma of criminalization for simple use and all of those things pulling together are all the pieces that you need to do to deal with this issue, as opposed to saying, let's find one thing we can do that'll be a silver bullet. And at the end, I know you're going to say it, substance use disorders and substance use is a health problem and not a criminal problem. It's a health problem.
Well, and let's be honest, the majority of Canadians use substances, whether it's alcohol or other substances, whether it's, you know, nicotine or other substances. We've really stigmatized certain substances and allowed a free rein on others that are, you know, if not equally harmful, in some cases more harmful. And I'm talking about you, alcohol. It's a killer, and it is also so widely accepted and promoted. And so I'm proud to be part of a government that is having a more comprehensive and compassionate conversation about substance use and, you know, really understanding that people who are using substances problematically, what they need, you're right, is healthcare, and they need dignity, and they need support to live in their communities free of stigma. And the more that we can actually do that, I think the more chance that a person has to actually live a healthier healthier life, to live a safer life. And obviously cities are safer as a result. So it is good for the city too, you know?
And my friend, the great Julio Montana, that I think is a personal hero of mine, what he always says is if we look at substance use disorders as a chronic problem, in the same way we look at diabetes and we look at all kinds of other things as chronic problems, let's allow for people to live the best possible life they can with that health problem.
That's exactly, I love that. I love, you know, listen, when someone has diabetes, we don't write them off, even when they don't take care of their diabetes. I think about this all the time. You know, there are a lot of diabetics that are not following the health advice that they get, whether it's on nutrition or exercise. Some people even neglect to, you know, monitor their own blood sugar levels. But we don't throw them in jail, and we don't tell them that they're bad people. We continue to help them. We continue to support them through our healthcare system, and we continue to love them, right? And so I think, you know, listen, I don't have time for the last question, but I do want to, I know time has flown, 8:59. I have a call with another Minister of Health.
Have you? Okay.
But
the last question was something you touched on, actually. It's from Dr. Kathleen Ross, who used to be president of the Doctors of BC, and she's just asking you about pregnancy, the need for ICU care, intubation, circulatory support. What steps will Canada take to ensure the vaccine is safe and effective in pregnant women?
Well, for sure.
Quick and dirty.
In 30 seconds, listen, unless it's indicated as safe for pregnant women, we can't authorize it for use in pregnant women. The regulators won't. But that is a question that's being asked of manufacturers, and they're working as quickly as they can to figure out this problem. So I kind of have to leave it there. I do have a call and I can't be late, unfortunately, but I want to thank you, Hedy, for an amazing conversation as always, and for your incredible leadership. And please, I'll come back anytime. I'd love to talk more with you about all things we see.
That's great, because I appreciate your candor. You're making the time, and you're staying till the dead end for everyone who are listening in. Okay, no pun intended.
Have a good evening. See you soon.
Good evening. Thanks.
Bye-bye.
Bye. And thank you, everybody, for listening and for coming on and for listening to a very important person that I think is extremely compassionate, looks at science, understands, is intelligent, knows where we should be going, and is working very, very hard to deal with some of the problems you talked about. Thank you for coming. Thank you for listening. Maybe we will get Dr. Patty Hajdu back again sometime soon. Thank you. Bye, everyone.